In an emergency, every minute matters, especially for trauma patients on board an ambulance.
And those patients are showing signs of shock. And they're hemorrhaging, either from a postpartum hemorrhage or some kind of trauma.
St. Luke's is the first in the region to carry whole blood on its special critical care transport ambulances. And now, blood is on board 6 of its ambulances in Monroe County. Paramedics say it buys time before patients can arrive at the emergency room.
Our options were essentially, and I'm oversimplifying, salt water, normal saline. And we realized in trauma patients especially that it wasn't helpful. Blood was always the definitive care.
Chris Zukowski is the critical care transport nurse manager for St. Luke's. He says recent changes to protocols for emergency services made this possible.
A couple years back, Pennsylvania did not have a protocol that allowed our EMS providers to administer blood in the field. So one of our ER doctors, Dr. Brian Wilson, in conjunction with many other physicians within the Commonwealth, developed a protocol for our EMS providers to administer blood.
The blood on board is the universal donor O negative. Paramedics use specialized technology to keep the blood at the right temperature.
Ice packs and the coolers that we carry are rated for over 72 hours. They hold that temperature for a really long time, so that blood temperature never changes.
Rotate that blood out weekly. That blood goes back to the hospital, and it is utilized by patients in the hospital, in the operating room, in the emergency department.
St. Luke's University Health Network first implemented this on ambulances in Bucks and Lehigh counties before expanding to Monroe County back in July.
But Monroe County in particular, there's not a level 1 trauma center here. We want to make sure that patients here that were having hemorrhagic shock or needed blood would have that ability to have it.
Emily Kress, Newswatch 16, Monroe County.